Hey everybody, Tribe Nursing here. In this video, we're going to be interpreting EKGs. Specifically, we're going to be talking about 6-second EKGs. We're going to be talking about the treatments and determining what the EKG strip actually is. I'll put some knowledge questions at the end of the video so you can test your knowledge. In this video, I'm going to be using an iPad Pro to determine what the 6-second EKG strips are. And with that being said, let's get started. Okay, so this is the first strip that we're going to interpret. So remember the rules. What is the rate? That's the first rule. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So we have 12 R intervals. Multiply it by 10. Now we have 120 beats per minute. Okay. Next rule. Is it regular or irregular? Let's check it out. So this QRS complex is equal. So is this. So is this one. So they all appear to be equal as far as QRS complex. So I would say it is regular. The next rule, we want to check what the rhythm is. Is there a P for every QRS complex? So let's see. So yes, 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 yes. So it appears that there is a P for every single QRS complex. All right, perfect. So we can say that this rhythm would be sinus tachycardia, with a rate of 120 beats per minute. Okay, so for sinus tachycardia, the treatment options that you want to, first you want to see if the patient is symptomatic. So if yes, the patient is symptomatic, how do we treat it? Well, first thing we want to do, we want to try a vagal maneuver, meaning we want the patient to bear down so you can decrease the heart rate. With the vagal maneuver, it stimulates the vagus nerve and decreases the heart rate. Have them blow through a straw because that has been shown to help decrease heart rate. Also, you want to give a beta blocker. Most likely they might give it IV. That's going to help decrease the heart rate. So you want to give cardioselective beta blockers. Also, if they are symptomatic, how would you know? It's because they have low cardiac output. So if they are not being perfused, you're going to see signs and symptoms associated with that, such as low capillary refill, coolness of their skin. You know, those are some examples. What if they're not symptomatic and they're just anxious? Well, you just want to help them relax. Introduce some breathing techniques. There's a breathing technique called the box technique where you breathe in for 4 seconds, you hold it for 4 seconds, and you release it for 4 seconds, and you repeat the cycle. And it has been proven to decrease the heart rate. Depending how symptomatic they are, you can also cardiovert them into normal sinus rhythm. And something else to keep a note of is that with sinus tach, it's going to be above that 100 beats per minute. Normal is 60 to 100 beats per minute. Okay, so for this strip over here, let's go ahead and determine the rate. So we have 1, 2, 3, 4, 5, 6, 7, 8. So we have a rate of 80. Is it regular or irregular? QRS complex appear to be regular, so we can say it's regular. So if for the rhythm, is there a P wave? That is a negative. Okay, so let's look at the P waves. The P waves appear to be in a sawtooth motion, as you can tell over here. So that's the biggest indicator. So this is known as atrial flutter at a rate of 80 beats per minute. All right, so next interpretation, always remember the rule. So what is the rate? Let's count it. 1, 2, 3, 4, 5, 6, 7, 8, 9. So 90 beats per minute. Is it regular or irregular? Well, this QRS complex is long. This one is normal. This one's normal. This one's long. So this one's irregular. So what is the rhythm? So is there a P wave? There is no P wave. There are none. This, if you look in the middle, you notice that this is known as fibrillation.
meaning that the atrium is fibrillating or quivering, fibrillating. So you can call this rhythm AFib. The difference between A flutter and AFib is that A flutter has more of a sawtooth pattern. AFib has more of a squiggly line.
So for AFib, A flutter, you can kind of treat it the same as well. You can actually group them together. So first off, we want to control the rate, and we want to prevent any blood clots from forming. So we need to place them on anticoagulants. So some anticoagulants that they will be placed on is heparin drip if they are in the hospital, and warfarin if they go home. Some other choices they could be placed on is Xarelto and Plavix. The reason they're placed on anticoagulant is because the left ventricle is pushing blood back into the left atrium. The left ventricle is considered to be a highly pressurized system. The left atrium is considered to be a low pressurized system. So what's going to happen is that the atrium is going to quiver like this, and it's going to fibrillate or flutter. So meaning that blood is now going to be stasis. It's not going to go anywhere. So it's going to clot, and now it can cause an embolism, pulmonary embolism. It can cause a stroke, renal embolism, a splenic embolism. Depends on where it migrates to. So that's why we place them on anticoagulants. Now for rate control, we want to place the patient on a calcium channel blocker, specifically Cardizem drip. We can also place them on Diltiazem. Cardizem drip is going to help control the rate. Beta blockers is also used, and also you can also use digoxin as well.
All right, so next drip, remember the rule. What's the rate? Well, it's very hard to determine on this one. Is it regular or irregular? Well, that's also hard to determine. The rhythm, there's no P wave. But you do notice that there are these pulses over here. And there's no QRS complex. There are no P waves. This right here is known as pulseless electrical activity, also known as PEA. If you see this on the rhythm, run. All right, another strip. What's the rate? It's extremely hard to determine on this. Regular, irregular. Well, you really can't determine it. Rhythm, there's no P wave, there's no T waves. It's just a flat line. This is known as asystole. If you see this on the rhythm, run to your patient immediately and begin CPR.
Okay, so asystole is a flat line. Also, PEA, you can kind of treat them the same. Some treatment options for asystole and PEA. First things first, if you see on the monitor, call a code. Second, you want to do high quality CPR, meaning you're compressing 2 inches within that chest. Also, if need be, if you're compressing, you get tired, switch with somebody else. The third treatment option you can do is giving epinephrine 1 milligram Q3 to every Q5 minutes until it's necessary. So with epinephrine, it's going to just try to stimulate that rhythm. See, the reason we cannot shock it, meaning it is an unshockable rhythm. So all we can do is just give high quality compressions and provide epinephrine for the patient.
Okay, next strip. Remember the rule. What is the rate? The rate is 1, 2, 3, 4, 5. 5 times 10 is equal to 50. Anything less than 60 is known as sinus bradycardia. Is there a P wave for every QRS complex? I mean, you can kind of see it here. How about, what is it, regular, irregular? You can say it's regular. So this is sinus bradycardia.
Okay, so for the treatment options for sinus bradycardia, sinus brady is less than 60 beats per minute. The treatment options, if they are symptomatic, you want to treat them with a medication known as atropine. It's going to stimulate them to increase their heart rate. And what it's going to do, you're going to give it at 0.5 milligrams, and the max you can give it is up to 3 milligrams, meaning you're going to give up, you can possibly give up to 6 doses. Also, doctor may order is that they may order a dopamine drip IV. That's also going to help with the cardiac output and help with the tissue perfusion, because they are not maintaining their cardiac output due to their low heart rate. Third, if none of those options work, you have to use electricity, and the specific electricity we're going to use is known as transcutaneous pacing. The use of transcutaneous pacing should put them back into normal sinus rhythm. With surgery, they may place in a pacemaker. The reason a pacemaker is used is because the SA node is not sending that impulse to the AV node. Therefore, we have a low heart rate, such as sinus bradycardia, with less than 60 beats per minute, resulting in the insertion of a pacemaker to help pace that heart.
Okay, new strip. So what is the rate? 1, 2, 3, 4, 5, 6. Okay, so 60 beats per minute. Okay. Is it considered to be regular or irregular? You can say it is regular. Every QRS complex look equal with one another. What is the rhythm? Is there a P wave for every QRS? Yes. Okay. But if you look over here, let me zoom in. This over here, that, this, and this, that's the T wave. But if you notice it, it is dipped. So when it's dipped, that is considered to be an inverted T wave. The issue with that is that the patient may have low potassium. So this would be considered to be normal sinus rhythm with an inverted T wave.
Alright, so what if you have a rhythm, like normal sinus rhythm, with a T wave inversion? If the T wave is inverted like this, that means hypokalemia is a possibility. So if hypokalemia is occurring, you want to trend the potassium levels. Potassium, the normal level for potassium is 3.5 to 5. So what you want to do is call the doctor and let them know that what their potassium level is, and that you notice an inversion on their T wave. As soon as you do that, they will prescribe a potassium supplement to increase their potassium levels and hopefully bring their potassium back up.
Okay, so here's another rhythm. First things first, first thing I notice is this ST elevation. This ST segment is considered to be peaked. From there, I will automatically think that this is a myocardial infarction. It looks like a fireman's hat in a way. You can also look at the rate. You can see that 1, 2, 3, 4, 5. I mean, it has a rate of 50. The issue with this patient is that they're not being perfused adequately due to this ST elevation. One of their arteries are clogged or just spasmed, so this patient needs to go to a cath lab or get a CABG immediately.
So treatment options for an ST elevation, known as a myocardial infarction, or also known as a heart attack. The emergent treatment, you want to give them, you want to do MONA, meaning morphine, oxygen, nitrates, and aspirin. That's the first thing you want to do as soon as they come into the ER. The next step is that you want to get them either down to cath lab or CABG. Depending on the blockage, depends on where they will go. If it's just one vessel that's occluded, they'll probably go down to cath lab. If it's multiple vessels are occluded, they will go ahead and get a cabbage.
Okay, new strip. All right, so remember the rule. What is the rate? You can't determine it on this one. Is it regular, irregular? It is most definitely irregular. Is there a rhythm? Is there a P wave? There's no P wave. But the way I look at the strip, you can tell that this is known as fibrillation. This is fibrillating. This whole entire rhythm is fibrillating. So this is something known as ventricular fibrillation, or VFib. If you see this on the monitor, make sure you run to the patient to see how they're doing. Sometimes they just might be showing no signs and symptoms, but they're unconscious. I'll go ahead and explain the treatments for that. All right, new strip. Okay, so what is the rate? You really can't determine it on this strip. Is it regular, irregular? Well, they all look alike in a way. What is the rhythm like? There's no P waves, there's no T waves. Okay, but they all look alike. I'm not sure if you noticed that or not, but they all have a similar dip and run up. So this is known as something called ventricular tachycardia, but more specifically, it's known as monomorphic VTach. The reason we call it mono, because it's all the same. Meaning from mono means it is the same. So these are all the same dips and elevated segments. So this is known as monomorphic VTach.
Okay, so let's say you're at the nurse's station and you're looking at the cardiac monitor, and you notice the patient goes from one rhythm into ventricular fibrillation or VTach. So these two arrhythmias have similar treatment options. Also, it's very important to know that it is shockable. If a patient is unconscious and they have ventricular fibrillation, first things first, call a code and have somebody get the code card while you're in there doing CPR. When you're doing CPR, it has to be high quality. When you are compressing, you are pushing at least 2 inches within their chest. So you have to do high quality CPR. The third treatment is that you need to defibrillate them. The reason that you need to defibrillate them is so you can put them into normal sinus rhythm. If you're seeing this on the monitor, you shouldn't be walking to the patient's room. You should be running to the patient's room. Because first off, every second that patient is unconscious, has one of these arrhythmias, their life is on the line. And this goes along with monomorphic VTach, polymorphic VTach. You can group these treatment options all together. So that is the end of the video. I hope you liked it. If you did, make sure to give it a like and subscribe if you haven't, and share it to your friends for those who are learning EKGs. And also, if, you'll also have the choice to go on Etsy.com. I'll leave a link in the description so you can follow along with my YouTube lectures if you choose to. And with that being said, thank you and have a good one.